we organized the Cynthia Perry Ray Foundation, which is our nonprofit outreach in the community. We became a 501c3 in June of 2011. I think that's when it was, 2011. And from that point, we started doing health and wellness. We do scholarships. We work in collaboration with another group with putting furnishings and what have you for people who have been homeless that now have a place to stay, but they have nothing. And when we say nothing, they don't even have foil paper in the drawer. So whatever you give them, they're very appreciative of it. And then the sisterhood falls up under the foundation. Just let me know whenever you have the slides up so I can go through that. So I'm just.
I don't have the slides. Do you by chance, did you send them to me or Dr.
I'll send them to you.
Me? I don't have them.
Well, let me do it again. That's where I'm doing my talking from. Let me see here. With that, I've had a relationship with the faith community for a long time. I have been president of several clergy wives groups, including my own that I organize. But I did have the Baptist ministers' wives and the interdenominational ministers' wives in the Los Angeles district. So I've been around for a while, and sometimes it takes a long time for things to come to pass, but don't give up when you really feel led to do what you know it is to do, because sometimes it just does take a long time coming. But this past few years, we have really expanded. Okay, I just sent it to you. Expanded our reach in the community with through the religious community. Part of what you do in being a coach is you got to build relationships with people. And I have built relationships. I go where they are. You can't expect people to come to you, they don't know you. And a lot of times when you go to them, they're in organizations. When you make connections with organizations and you make yourself be known to them, you have all sorts of resources that's available to us as community members, that all you have to do is ask for them and they'll give them to you. Like our connection with LA County Public Health. Public Health has everything on there from food insecurity, relationships to get people who have babies that need formula, milk, different other things. All that's at our disposal. But it's not going to just come to us. It's going to be something that we have to go out and do. And from the religious side of things, faith without works is dead. You can believe something, but you still got to put some action into it to make it happen if you want things to go along. Did it come across now? I sent it to your CDU email.
No, not yet.
Not yet.
I'm checking, I'm looking, but not yet.
Well, let me see here. I'm trying to see how I can get it in my own, because I'm not on my own computer. And see, because everything is in that, what I want to talk about. I'm trying to see how else I can get it to you.
Even to my Gmail, maybe.
Okay, let's see here. Look in your phone and see if you can forward it to yourself. But anyway, from the sisterhood perspective, what we did was we looked at our communities are suffering from, we're number one in so many things that are not right. We have the highest incident rates of diabetes, cancer, and what have you. And a lot of it has to do with health literacy. What I did learn at Drew, if nothing else, health literacy is a worldwide problem. And it's not just worldwide, it's pretty bad. And it's that because we don't know that we have certain rights to certain things that we just don't know. And so we have too much at to our disposal now. When we were first coming along, at my age, when we were younger, we had to go to the library. We had to look at the newspaper. We had to do things like that to find out what was going on in the world. We don't have to do that now. We actually can Google just about anything we want to know and find that out. Now, this first screen that's on here, that's a picture of Harriet Tubman reaching out, and it gives the image that that's what we're supposed to do, is to lend a hand to people, especially those who are unable to help themselves, and make the connection. Our overall theme is providing a ray of sunshine through the gift of encouragement. Next. Our vision is caring for the health and wellness. It's been a major component of what we do. The health of minorities is a global problem, but through education, we can help people understand that something just as simple as taking a vitamin that we're missing out of our diet can make the difference from you being on some tubes or being hooked up to a dialysis machine versus just making some health changes where you don't have to be on dialysis. Dialysis is when somebody tells you that you're in kidney failure, until they tell you that you have to go on dialysis, you still have an opportunity to turn that around and make changes. That's part of what we learned when we took our classes through the Kidney Foundation. Next. I mentioned to you before about who we are and where we come from, and our overall theme is a visionary involvement to educate, equip, empower, and engage people into the work that we do. Next. Even though we have medical professionals in our group, we always let it be known that we don't give medical advice. All we do is give you information for you to check with your provider and to look at, because everybody, it's not a one size fit all when it comes to health. So we let people know right off the bat, we are not doctors. I can play one on TV, but I'm not one today. And well, I got doctor in front of my name, but I'm not a medical doctor, okay? Next. We have biblical references to why we're called to serve. Giving support to people in the houses of worship, that's our job to do. Then I put scripture references that what we are as children of God, we are called to serve. And this will be available to anybody. I did a lot of writing on these instead of bullet points because I want you to have an opportunity to read what it is I'm saying. Next. The role of a Black church in creating change. Historically, the church has been a place where we made a lot of changes. When I came up as a girl, when our people started running for office, where did they go? They went to the church because that's where the numbers used to be, the larger numbers. And even in our study of women getting the right to vote, the Black women were very much present and engaged in that 100 years ago when they met in the Black churches to get the women together to rally them to get the right to vote. You can guarantee that on Sundays between 7 and 4, we have the attention of a large population of people attending church, including online. The Black pastors in churches, in our Black churches, have had so much influence on our community. We believe them. We have trust in them. My pastor was Pastor James Brooks from St. John, where I grew up. He lived to be 106. And when I grew up in church, we were told what the pastor said, that's what it was, because we are what? We believed him. We trusted what he was saying. And so what through this outreach, we utilize the influence that pastors have in their congregations. The days of complaining is over, It's time for us to stop talking and start walking. I'm not talking just to the pastors, I'm talking to the churches and to the membership too. So, what is your role in helping the pastor create the change? That's why a lot of these pastors suffer from so many health disparities themselves because they're trying to do it all themselves and they cannot do it all. But they can be influential to the ones who will support. We cannot just continue to attend church and leave. We need to attend church with a purpose and leave with an anointing and an agenda. Next. I did this poster for City of Hope, and what it shows is the small churches versus what they call the mega churches. And if you see down below the picture of the ladies with their hands up, it's a map of the churches that are the one on the left. It's the number of smaller churches in the LA County, and the one on the right is the what they call the mega larger churches. If you see on the left, there are a whole bunch of small churches. A whole bunch of small churches. And what through this is what I showed in my research, that even though churches may be larger, they still don't have the influence and effectiveness that a smaller church could have. But when collaboratively, when the churches work together, the smaller churches, they can get a lot done. Next. Small churches have three distinct strengths. They have a personal relationship with the pastor. A lot of them that belong to large churches, how come many of them can tell you that their pastor actually knows what their names are and know anything about them? And when you're in a smaller church and you have a relationship with a pastor, you're willing to talk and say things that you wouldn't say to somebody that you don't know. And again, they trust what's being said to them and the personal relationship they have with a pastor. And it can't be available to everybody as the church gets larger. But overall, most churches that are smaller, the pastor knows his member. Next. There's opportunities to develop gifts and talents when you're in a small church. And this pastor that pastored the church in Fountain Valley, he said that to train a 12-year-old drummer and just throw him, you know how we do on Sunday, come on, Junior, you can play the drums. And we're tolerant of that and letting him come over there and he may be off beat and stuff, but we're encouraging him and trying. But when you're in a church with 3,000 people, some of them paying big money with a big stage and stuff, they're not going to have that kind of tolerance for that. So it kind of helps build character, it helps build self-esteem and things when we let our, especially our young people, have an opportunity to do things. We need to help them and not criticize them. And it's an opportunity for lay people to lead. I understand in one church that you had to pay big money in tithes and you had to show your tax form in order to be president of the choir. And God didn't call us to all that. But we do have advantages to being in smaller churches. Next. Let's appreciate and celebrate the small churches. Over half Christians on earth are involved in churches that have 250 or less in them. And then they categorize what they think, what church sizes ought to be, what they call a smaller church, a larger church, a standard church, and whatever. So I just threw that in there. So just see what they are. Smaller churches are not a problem. They're blessings. Next. Because I'm going to get to why I'm saying what I'm saying. Under our Witness to Fitness program, this is what I designed under my leadership, that health disparities can be reduced and eliminated by strategically addressing vulnerabilities. What does this have to do with a smaller church? What I was able to show to public health and some other ones, that my church may be a small church, but my reach is large. The influence that pastors have over their congregants, just say that you have 10 people that you know will do what you ask them to do. If you ask them to go buy milk at the store, that's what they're going to do because that's what you asked them. You take those 10 people and you tell them that I want you, well, you ask them, you don't tell them. You ask them, I want you to tell 10 people that taking vitamin D3 every day will help reduce and eliminate the possibility of eliminating colon cancer. It helps with this COVID, believe it or not. The lack of vitamin D3 and D vitamins has been a culprit of this thing. And they go tell 10 people. You've covered 100 people just with those 10 people. So the more people that you influence and multiply doing that, you can expand your reach. The size of a church has nothing to do with the impact of its influence. I send text messages every day, which some of you haven't received yours yet, where I send out an encouragement and a health and wellness of some sort. Like yesterday, I think it was on the benefits of garlic.
Amen.
The other day, that was what 11 ways that collard greens are good for you. And one of the pastors told me he had a yard full of greens and he gonna give me some. So he called yesterday and he says, I can't get them to you yet, but I'm gonna get them to you. I told him that's all right because I'd had to go in the kitchen. So it was okay with me. But they in turn, what I send, I get responses back telling me that they have shared with other people. So see where it said taste of coalition? Just out of the group of people that I text every day, and I individually text them in case they have something they want to say back to me. They have taken and sent that to others who sent it to others who sent it to others. Do you see where I'm going with that? Just something that simple, sending that out. Okay? Send in the next page. Okay? When we educate our people on the rights of things, they will tell us in a minute that we're not covered for certain things and whatever, which is not true. You have to go to the top people and just make an issue of it. We take too much of no, like that's all that can be done. That's not true. But when you make people aware that they have these rights, it makes a difference. Increasing our social determinants, such as lack of food and medicine and education, insurance, those kind of things can come through the church with information. Like I got text today about Meharry College is giving a scholarship for Black doctors, male Black doctors. We need male Black doctors. We don't have enough Black doctors. And I talked about the health literacy becoming expanding that. Next. Okay. What we do through our health and wellness is to empower, engage. One can be taught, which is educated. You equip them by giving them materials, and you encourage them that they can do it, and you engage them. And what you do is training and education, just like what you're doing today. Instead of just sending people out to do something, you show them what it is that you want them to do. And there are organizations and places that can help you with that and give you places for resources and things that you can put through your churches. Next. What our Witness to Fitness program, what we had done, and this can be done by any church and in churches, we recruited so far, I think, 22 churches and 3 organizations that every month we do what's called Witness to Fitness Day. Witness to Fitness Day is like an infographic that we give out that's like examples of what you see here. What we do not put our name on them. We put the church's name on it. So like the one that says cardiac arrest, that one actually has the church name, First Missionary. The clean eating has a church on it. I think it's top, yeah, Emmanuel, like that. And we participated in No Menthol Sunday. So that was our thing, is Witness to Fitness. And what we do, we want the church to have somewhat a pride of a contributor to this program. And once a month, we ask that whatever it is that we share with them, share it with the congregation. It's usually a one-page infographic that has things on it that would be good for them to know. This past month, we did colorectal cancer. It was 2 pages. And last month, we did one on the vaccines, the different vaccines, breaking it down, what the different vaccines meant, to put that kind of education in the churches. What can be done with this? Go to the next screen. I think it's on the next screen. Yes. In using those infographics and putting the church's name and the pastor's name and whoever else they want on it, you can also use that as an evangelism tool for your church and give your church an opportunity to witness to others. Health is a great treasure, and when you help people try to stay healthy, they're going to pay attention. So every month when they see something come in, and the way we word the date it, we just put like this is March. We just put March 2021, even though second Sunday is Witness to Fitness Day. The infographic is good for the whole month. So you can always take that infographic and send it to people that are unchurched, people who have slacked off from church, and put it on your social media and etc. and use it as a tool to do evangelism work with. Action speaks louder than words. And when you send people stuff like that, it gives the semblance that you care, which you do. And that's our job as people of God, is to look out and care for one another. Next. These are some of our collaborators. Got a couple of them that don't have logos, but these are the people that we work with different things. LA Metropolitan Churches has a lot of resources for the faith community that's available with no charge to get from them. They've been around for a long time and have done a great job. City of Hope is a place that we do not, as people of color, deal with, which we should, because they have all kinds of treatments and things for cancer. And especially if you have veterans benefits, that they can give you second opinions. If the doctor can't do a thing for you, well, they just might be able to. You just never know. And our relationship with Charles Drew University has been a fabulous one. We're connected with the Anti-Tobacco Coalition, and tobacco is destroying our communities. No, it should not be a crime to have a cigarette, but our people need to be educated how we're being used to make money and what damage it does to our bodies with the menthol smoking. Next. I'm in the home stretch now, preachers. I'm getting ready to bring it on in. We have two ladies who are our Witness to Fitness chairs, and they are registered nurses. One is Ronelle Nichols, and the other one is Valerie Rogers Owens. I have 3 administrators who help me with Witness to Fitness and doing the monthly outreach. We do more than just a once a month outreach. Whatever it is a church needs, just say your women of your church is having a women's conference and you need information on something that's pertaining to women. Tell us what it is, but give us enough time to get it to you. And we will forward it to you get it to you so you'll have it in time for your session. Next. That's our contact information. Anything you want to call or ask us, email us, talk. We're here to help and be a support to the churches. And just remember, connection is everything. Making that contact and utilizing the influence that we have on one another, and just being there for one another. But the main thing is getting the information to one another to make a healthier, better you. And again, it could be something just as simple as making a simple change of our vitamins and minerals and things in our system can make all the difference in feeling better. And I think that's the last screen. Thank you and have a great day. And thank you for all who gave me an opportunity to do this. And if anybody have